Hey everybody, I know I talk about distal radius fractures a lot, but I want to talk about this kind of location where the surgery occurs. This would also apply to ECU surgeries and TFCCs, especially TFCCs. But what I'm discovering, what I think I'm discovering, is that this population has a higher sense of fear, anxiety, despair, depression, and definitely more pain. And there's a reason why they have more pain. And there's a reason why we should be gentler in our treatment rather than aggressive. Most people think we need to be aggressive, and we need to stop writing orders for that. We have to be very conscious of their sensory nervous system and the forces that are applied to the sensory nervous system. And this would explain why they would have so much pain. So the one muscle that is fascinating in this scenario is pronator quadratus, and he goes this way. All the other muscles go longitudinally, but he is the one muscle that goes like horizontally. So pronator quadratus, okay? I think he is a major player in this diagnosis and why it is so painful. So we added maybe a distal radius fracture scar here and thought about the pull of everything in the way of tensions. Everything is pulling towards this distal radius fracture scar. Also, the fact that this muscle goes horizontally is a big part of this picture. So if you think in sections, this would be a section, this would be the humerus, this is a forearm, this is the hand, fingers, obviously metacarpals, and then fingers. The skin should move freely in sections, each section back and forth. It should move freely around the limb and through these quadrants. So these orange lines are designed to show quadrants. So midline on the volar surface, midline on the dorsal surface, and on the radius and the ulna would be the outside. So that would break up the arm into 4 quadrants. So the skin has to move back and forth freely. And if you looked at the side of the arm, the dorsal skin and the volar skin are very different. And what I've discovered from all my videos is all of the pain primarily is on the dorsal side of the hand. So if you have tensions that are pulling around the sides or the side seams towards the volar side, this is going to tension everything very significantly here on the sides. Now, the green represents the radial styloid and the ulnar styloid. And once you have tensions that are pulling so tight to the volar side, you now are creating tensions along here and definitely over these bony prominences. So if your exit points for the SBRN, obviously my favorite nerve, and the dorsal cutaneous branch of the ulnar nerves are right around these styloids. So if they come off here and they exit and they come down the hand, obviously on each side, fingers for the SBRN, that's the blue one right there. And if we did the exit point for the dorsal cutaneous branch of the ulnar nerve, okay, so pretty much the whole top of the hand exits right in this location. So if we are not addressing the skin and the skin tensions from this location down, and we're trying to create, therapy treatment models where we're trying to aggressively get range of motion, and we're not freeing this up, we're essentially tractioning these locations and everything distal to this location. So if the cutaneous nerves, these sensory nerves, are reading information that is reporting a high amount of pain to the brain is going to swell. It's going to stop the movement. It's going to tighten the joints, the muscles, the ligaments, everything, the tendons. So if we can free up this location, we can change the information to the brain. So what that means is get everything away from the scar directions, get everything from midline out on the dorsal and volar side, okay? Because once this pulls really tight across here, even this section has no mobility. So we need the skin to move back and forth freely, top and bottom. But if it's stuck on these midlines, it's going to traction the sides, okay? Once the sides get tractioned, they're going to activate the sensory nerves and the protective response occurs. So the key is stop doing aggressive therapy, free up the skin, be gentle, and you'll get all the range of motion you want. If you stay and keep watching, you'll see one of my favorite ways that I like to tape to help get all the quadrants free, the skin moving, nothing becomes adherent. So hopefully this will help you with your patients and we cause them less pain and less fear, anxiety, despair, and depression. Thanks. And then you're just going to cut thin little strips along it. Here, just leave kind of a half a tab at the end, so don't cut past that tab. When it comes out, it's going to look like this. Okay, let's do the superficial layer. All right, perfect. Okay. So you feel it a little bit on that, on the sides? Okay, all right, then we'll tape it and we'll see. Down. So you always want to be on a stretch, but not a painful stretch, so whatever stretch you can get. And then this is just going to be a little bit of tension. So there's 0 tension, about 10 is plenty. And you're just going to try and lay the pieces up. Kind of like that, and then stick down the ends, and then gently lift them up. So you're kind of covering all the top and the sides. Okay, rub it a little bit, and then we'll do kind of the bottom side. Yeah, into extension. Yeah, perfect. And then tear it off again. Again, it has to be pain-free. This side you can pull the tape just a touch more because it is less sensitive. I'm gonna pick these pieces up. You don't have to spread them, but it covers more surface area. And then we'll cut this other one in half along the sides. Somebody in my class,
And then
like,
point down.
One, yeah.
Do I tuck the thumb or doesn't it matter?
You can tuck it a little bit. That feels okay. Yeah. Like, I think we did this one a lot when you were in your split. I think this made a big difference. So, we can lift everything away this way. Nice, and then we'll do more and more. The point of the nerve is right there, and then right there on that bony side, so you want to make sure you cover those. So you can even go into a little bit of deviation. Perfect. Look at you. I'm going to have a full-time job with my filmer. Probably could have put it up right in front of you and it would have been fine. There we go. So now we get lift all over the whole hand and wrist, okay? Perfect, see how that feels now? Feel okay? All right. Yeah, less pain on the sides? Okay, good. It's a work in progress.